Hi everyone. So clinical day 3 happened today. So I wanted to share with you a few of the things that I learned because in class you learn about them, but when you're actually going into the clinic setting, it's so much different. It's like taking what you've learned and applying it into practice, which is amazing to me. It's fun and it sticks with me even better. That some of the patients come into the clinic with shoulder injury, and so in this case we were assessing for rotator cuff injury. So the preceptor had me go in and do a few tests. Now what I learned in school was the Neers and the Hawkins, and what that included was having the patient for the Neers test. Basically what I'm having them do is internally rotating their arm. I'm This is all passive, so I'm doing it for the patient, and then I bring it overhead. And from school, that's basically testing for rotator cuff impingement or tear. Now, the other thing I learned from school too was the Hawkins test. And that again is all passive, so I have the patient bring their arm out like so, they bend it in, and then I passively bring their arm like this. And again, this is checking for rotator cuff impingement or tear. Now, both those tests are positive if the patient experiences pain. Now, I went in there, came back out, explained to the preceptor that's what I did. Now, he showed me something different that I didn't know about, and that is the full can, empty can, which I think this is neat. It's easy to remember. So the patient takes their hands like this. So it's actually like you're holding a can, and this is the full can, and then you have them bring it down for an empty can. So full can, empty can, and the same thing here, you're checking to see if there's any pain. Now, if there is pain, that's a positive indication for what they call a supraspinatus tendon or muscle injury. On both of those, so again, testing for the rotator cuff. And here I'll show you a picture. This is the supraspinatus muscle, and that's essentially what we're testing for. But yeah, it was fun. I enjoyed it. And those were the things I wanted to share with you. The Hawkins Neer test, full can and empty can. Thanks for joining me.